everyone. Thanks so much for joining today. My name is Isabella, and I'm excited to be hosting today's webinar. Today, we'll dive deep into trends, challenges, and AI in the Athenahealth ecosystem. We surveyed over 120 healthcare organizations and filtered out responses to focus on teams using Athenahealth to understand what's actually happening across revenue cycle today and where teams are feeling the most pressure. I'm joined today by Kathy Saunders and Dan Milano. I'd love to pass it over to you guys first to introduce yourself. Kathy, would you like to start?
Sure. Thanks, Isabella. Hi, I'm Kathy Saunders. I'm the SVP of RCM for Redefine Healthcare here in New Jersey.
Hi, everybody. Dan Milano. I'm the director in solutions consulting here at Adonis. Prior to Adonis, I spent a grand total of about 12 years at Athenahealth, all in the implementation and onboarding space. So when I talk about Adonis here with Kathy today, know that it comes from having lived inside the Athena table space, the kick code logic, pair enrollment, the works. So ultimately, my job here at Adonis is to ensure that practices that we work with get every dollar that Athena was already designed to help them collect, and then unlock that next layer that any PM platform alone can't reach.
Awesome. So before we dive in, just a few housekeeping items. We'll be recording today's session and can send it out afterwards. If anyone has any questions, be sure to drop them in the chat and we will follow up afterwards. To start, we'll dive into denials and how they're showing up at the executive level. So 55% of Athenahealth users told us that denials are now a strategic concern that's being discussed at the executive level, not just managed within our CM teams. Question for you, Kathy. Has that shift to executive visibility been true within your organization, Redefine?
Oh, absolutely. And I think more analytics, more detailed reporting have brought these denials to light at a higher level. We see these trends much quicker now with all the analytics that we're using, the reporting that we're using, and of course with Adonis.
Awesome. And how are you thinking about denials today relative to, a year or two ago?
Oh gosh, so the old standby for us were AR reports, right? Claim by claim review, really going into the trenches of each claim and finding out what the issues are. I feel like we've evolved so much from that now. I will say that the reporting for us has definitely changed the way our team is reviewing each claim. They're doing it at a higher level and more claims at a time where we can fix claims quicker, faster, and the turnaround time is so much better.
I mean, if I can jump in, like that 55% stat isn't surprising to me. What's new today is that CFOs of healthcare organizations, they're not asking just like what's our denial rate. They're asking why. They're asking by pair, by service line, right? By DBA. And they're also asking the Kathys of the world, what are we doing about it yesterday? Like, what are we going to do? Athena today gives you all of that data to get an answer. But what I think Adonis is striving to do is to essentially hand you the answer on a silver platter, right? Those insights are unlocked immediately with the data that we're ingesting from the 835s, 837s, and the data from DataView that we're receiving from Athena.
So I think with all of the items that you just mentioned, I think we are now proactive, not reactive. Adonis has made us a proactive RCM department. We know at a high level why these claims are getting denied. We're changing the way we're doing things. We're retraining our coders. We're retraining our doctors. We're getting ahead of changes in the industry, claim changes, CPT code changes, things that before you would have to wait for denials to start piling up to find the trend. Now Adonis brings that to light so quickly for us that we see something happen so fast that we can correct our mistakes if that's the case. I can give you a detail that just happened to us recently, that logging into Adonis one morning indicated that we had an increased denial rate with Horizon NJ Health. Horizon NJ Health is a very large Medicaid payer here in New Jersey. We have a very large database of patients that treat in this payer space. And that right away brought one of my team members right to me to say something's wrong. And there was something wrong. It was a very particular CPT code. The guidelines changed mid February. We didn't know about it, but we caught it very quickly. And we were able to react and get these claims fixed immediately.
That's awesome. No, yeah, that's really great to hear. And we have, a data science and machine learning team in-house who has built out these algorithms that are able to detect anomalies in payer behavior and things just like that, where, a certain payer's denial rate has spiked. And, we want to make sure we're alerting your team to that as quick as possible. So I always love to hear those wins.
Yeah, that was a win for us.
Awesome. And curious, Dan, from your perspective, if there's anything else that's missing from, various Athenahealth teams' current workflows or tooling related to denials specifically.
Two things. First, executive level visibility, the portfolio view across payers, specialties, TINs that a CFO can act on, and they can see in 5 minutes and adjust in 5 minutes. Athena gives you that data. Most teams don't have the time to mine it into that view for the CFO. The second piece is the agentic action. Once you know which denials matter most, who's actually going to make the calls, submit the documents, and follow up on the no response. That's the gap. Most Athena practices plug it today with overtime, offshore, or quiet acceptance that some of the money walks. None of those scale.
Awesome.
I couldn't agree more with you, Dan. I feel like there's times that my team is just spinning their wheels, making phone calls, trying to collect money that's really tough to collect. But now I feel like because we have a more visible view, this high level view of what's going on, we're able to avoid some of these denials very early on. Our clean claim rate is so much higher than it's ever been, with Athena, and along with what Adonis is showing us daily to make our changes, right? How to avoid these denials, how to make sure everyone from front desk, to my coders and billers are doing their job correctly.
Yeah. And there's an element too to that where Athena does a great job like identifying the denials and routing them appropriately at a high level. The other nice thing with the agentic action piece is Adonis has the ability to jump the line, so to speak, right, with the claim status inquiries. We just got done talking about offline, Kathy, the UHC portal, and how we may be able to take proactive measures before a denial is even received in Athena to avoid the denial completely, and you get paid on the first pass. That's where I think Adonis unlocks a lot of productivity for your billers, where they don't need to focus on scraping a portal proactively for what claims need medrecs, right? We could take that work on for you.
Yeah, love it.
Awesome. Next, we'll dive into AI and the growing demand for payer transparency. So, when asked which outcome would be the most impactful for AI technology to improve, the majority of respondents said payer insight and transparency, roughly 48% of respondents. Question for you, Kathy. How has your visibility into payer behavior changed over time?
Gosh, I feel like I finally have a view, right? Before I didn't have a view. You never knew what they were doing. It was always something that you found out once a denial came and it was too late. I feel, we are now able to do more detailed research with payers to know when they're changing, when their guidelines are changing. again, I mentioned earlier, we're definitely more proactive than we've ever been before. I feel like the analytics, the Adonis AI team have given us the tools to be better equipped to go in with, like I said, cleaner claims, knowing before we go in what may or may not get paid, making sure that even though something doesn't need authorization, our doctors are doing everything they need to do to make sure their notes have all the information to substantiate the need for medical necessity, which is, a big issue for us, across the board on some of the procedures we do here in the office. So I do feel that payer behavior and knowing what they're doing and thinking beforehand really assists, how we're getting paid and how our team is definitely handling claims. Would I like to see more of it? Absolutely. Would I like to know beforehand that, codes are changing and the guidelines for very specific procedures are changing and we need to change with it? We're getting there.
And if I can add to that, Kathy, just from an Athena perspective, I mean, Athena is, after years having worked there and onboarding new customers, a constant theme I heard is how transparent of a system and platform Athena is. And it is just that. It's extremely transparent, which is fantastic. But it's also a fire hose of data with the remits that are received, all the kick codes, the work queues, the ERA files. And to me, where Adonis enters is that opportunity, not for more data, but for the reasoning over that data, right? To me, that's what payer transparency through AI means. It's connecting that payer behavior and all of that data received, and that is transparent to you, but doing some of the mining and unsurfacing those insights for you so that you get better claim outcomes and you can make informed operational decisions.
Absolutely. So, logging into Athena every day and seeing what's happening with our claims instead of trying to review claims within Athena, where Athena's not always correct, right? They're not always giving us the exact reason of a denial, where Adonis is putting it right in our face every morning. Here it is. Here's your denials. Here's your reasons. It allows my team to understand Athena a little bit more, that now they can take the information they find in Adonis, go back to Athena and know what they're looking for now. Like, this is a big problem. These are payer denials. This is what I need to look for. So I feel like Athena alone, as great as it is, doesn't always give us the details we need.
Yeah.
Sometimes they give us too much information and it's not always correct.
In my time at Athena, the conversation around kick codes and the concept of kick codes is always a difficult conversation because billers don't speak in kick code; they speak in CARC and RARC codes, right?
Exactly.
And there isn't a explicit, I'll say, mapping out there like that's one-to-one necessarily of all the CARC and RARCs received on a remit to those kick codes. So there's a learning curve and there's a change management aspect to a transition to a platform like Athena. Again, they do a great job of surfacing all of the data, to your point, sometimes providing information overload on the claim. But I think this is where the intelligence platform of Adonis really, really supports RCM teams.
Absolutely. It definitely puts it at a biller's level.
For sure. And I'm curious, Kathy, what insights are the most valuable to your team today? Is it, like you said, the detail on denials? Is it payer policy changes? Curious if there's anything that you would sort of highlight as, the most valuable.
I guess the trends, right? Which payers are driving the highest denial rates and why is very big for us. Coding issues. That's a big one too. Change of CPT codes. Why certain codes are not getting paid? Are we not providing enough medical necessity to get these codes and these procedures paid correctly? I feel like that's a good one. And then, how to avoid these denials when they're brought to our attention. How are we avoiding them? How are we changing our behavior as a practice?
Awesome. And Dan, curious from what you've seen, how are some leading teams using the visibility provided to them differently?
Sure. To me, they're using it to get ahead of payer behavior instead of reacting to it. Um, Catching denial trends in the first week instead of the first quarter, going into a JOC meeting with a payer specific scorecard instead of just an anecdote or a story. And most importantly, routing the agentic work to the highest dollar, highest confident denials first instead of working from the queues top down. That's the operational shift. Um, yeah, I think that's it.
Love it. Great. So next we'll be looking at what's actually limiting growth for RCM teams today and where AI can make a real impact. So top three obstacles to revenue growth include denials and underpayments, payer reimbursement pressure, and staffing constraints. Kathy, how are staffing constraints showing up day to day for your team at
I
Redefine?
was going to start with that.
Mm.
I think it's a big one. This is a tough one for us. I feel burnout is a huge problem, right? I have employee burnout because it's getting tougher. It's getting tougher to collect high dollar claims, the phone calls, the long wait time, the change of payers without us knowing about it is frustrating for a biller who's been in this business a long time. And I think a lot of the staffing constraints I'm seeing also is fear of my employees that AI is taking over and not embracing it as much as they should be. When we first partnered with Adonis, that was the biggest fear for my team. Are they taking over our jobs? But I feel like we're almost at the year mark now, and the tide has changed so much. Now it's, wow, I was on AI and you're not going to believe what they found. And now it's a helping tool, right? It's assisting the team. So I feel like they finally are embracing AI and understanding how helpful it can be.
Love it. Yeah. And I
Uh,
know Redefine is obviously growing very quickly as an organization, which is super, super exciting. I'm curious if you've been able to unlock, additional capacity without adding headcount, and sort of what that looks like for your team, how you're thinking about it.
Oh, gosh, absolutely. So, like you mentioned, Redefine Healthcare in the past year has grown drastically. We have probably brought on 40 new doctors, providers, mid-levels over the last year. And to keep up with that in the RCM department is so hard. I feel like front end, they make promises, they bring on doctors, everybody's fine, things are going well, and then it gets dumped on RCM to make sure we're cleaning up fast. Adonis has really assisted us with AI phone calls, following up with payers, giving us detailed reasons why a claim is not paid, and where my team member can come in and now do the action that's needed and do the needy to get that claim over the finish line, get it reimbursed, let
And
that
that
claim.
foundation.
Yeah, without a doubt. I think it's truly helpful. My team can't get through all those phone calls. They just physically cannot. They'll get stuck on one large claim and realize it needs a denial, and now they're caught up, typing up a denial letter and not getting to any more phone calls. So Adonis has definitely taken over the phone calls from us in such a great way. Because as a collector, you hate the phone, and it's, phone makes you money. Pick up the phone. It's what makes you money. And it's probably the hardest part of the job.
It's, if I could chime in, like that's, you said it, that's where Adonis fits in on the agentic piece, right? We take the repeatable, the exception based work off of your team's plate, right? Those CSI calls on aged AR, the no pay, no response, doc submission workflows, things that Athena's identifying correctly as needing attention, right, on the back end, or in an ideal state, we're proactively monitoring those things and giving your team the foundation to take the action on the claim that allows it to get paid on the first pass.
Absolutely. And
Yeah, and
it's sad to say that there are so many times that a claim never makes it to the final destination for whatever reason, it goes through the EDI process and it's not at the payer. And Adonis finds that for us. They're making those phone calls, 14 days post submission, and they will find that a claim is not on file and we're resubmitting that claim. That helps because, before you're at that 30-day mark, you haven't received a payment, or 3 weeks and you haven't received a payment and you're following up. Adonis is catching that a lot quicker.
Yeah, that's great to hear. And I know, in orthopedics specifically as a specialty, you guys have some really, really high dollar claims as well. And so I can imagine it's helpful for the agents to be following up on some of the lower dollar claims to clear up time, for your team to be going in to chase the payer for the really, really high dollar surgeries.
Absolutely. So, we have quite a few neurosurgeons on staff. Those dollar amount claims are extremely high. So if a RCM team member is working the claim, they're not looking at the E&M, they're looking at the surgery. So we leave that E&M to the agents at Adonis to handle for us because that is just tedious work for them.
Yeah, for sure. And the agents, they can stay on hold and doesn't matter.
Right, exactly,
they've got
exactly.
all the time in the world.
Exactly.
Yeah, I love that. I love that.
Awesome. And Dan, curious
They never
from
come to
your,
my door either complaining.
exactly. Dan, curious from how organizations scaling RCM without scaling headcount and where the biggest opportunities are for efficiency there.
Yeah, a lot of practices that I worked with had the same problem, right? They were growing. Um, the work scales linearly with claim volume, but you can't really hire linearly anymore, right? The talent pool drains too fast. The burnout that Kathy talked about is real. So we need to be honest about the work that needs a human and the work that doesn't. The CSI calls that we mentioned, the aged AR, the no pay, no response follow-ups, documentation submission to portals, that work has a script, right? It's repeatable, it's high volume, low judgment. Agents do it well 24/7. They don't burn out. The work that needs a human, those exception-based resolutions, the payer escalations, the complex appeals, that's where you want every minute of your more experienced billers capacity, right? Leaders I see scaling well are drawing that line clearly and pointing each type of work to the right resource.
Absolutely. And I think as a collector, I could speak for my team. I think it's more satisfying to collect on a high dollar amount, orthopedic surgery, spine surgery, be able to pull that file together, that chart together, get all those medical records together, show medical necessity, get a denial overturned, and there's a large dollar amount. It's satisfying. And it's something that they can bring to their manager to say, hey, look what I did. Working on these small dollar amount tedious claims day in and day out, there's no satisfaction there. It definitely causes complete burnout.
Yeah, for sure. And curious, Kathy, as well, on the underpayment management front, kind of how your organization is dealing with underpayments today, things like downcoding, how you all are thinking about that and sort of where AI can fit in.
Yeah, so that's a big one for us. We are multi-specialty. We have many payer contracts throughout, many payers. And we have a lot of what we call carve-out codes, meaning that very particular codes receive X amount, and then I have one payer or paying my provider X. So, we're all over the place when it comes to what our contracts look like, and it's very difficult for our team to watch the behavior of payers to make sure we're getting paid correctly. With the AI and Adonis, that comes to light daily for us. They bring to our attention anything that's paid under our contracted rates, including any carve-out codes for specific CPT codes. Adonis has been able to take all of our contracts, all of our fee schedules, and incorporate that with Athena, with their AI tool, and daily show us anything that's being underpaid. For us specifically, as a client of Athena, Athena posts pursuant to an EOB. So they're going to post what's been paid. They're not looking at our contracted rates. They're not making sure we've been paid correctly. And Adonis is doing that. So we're able to go back in, reach out to payers for underpayments, appeal when necessary. But I think the biggest place that Adonis has helped us in this regard is when we have new doctors join. Believe it or not, payers don't always attach them to our contracted rates right away, and they pay them at rack rates. And you could have a doctor with you for months before someone picks up that we're being paid incorrectly. With Adonis, we'll see that. We'll see that right away, that our doctor at a clinic with a certain specialty is not getting paid correctly, but his counterpart is. So I feel that has helped us so much that I'm able to comfortably know that we're being paid correctly by each payer. And if not, Adonis is bringing it to our attention.
Awesome. So now let's shift to how teams are actually addressing these challenges within the Athenahealth ecosystem. Today, teams that layer intelligence on top of core systems see improvements in visibility, efficiency, and collections. Kathy, from your perspective, how does Adonis fit into your day-to-day workflows alongside Athenahealth?
So, I've been saying this all along. They give us a clear understanding of payer behavior, helping my teams with denial trends, identifying root causes faster, prioritizing, what needs to be done up front, what they could put on a little bit of the back burner for my team. But I think daily, the team members being able to log into Athena, review their claims, see trends, catch them quicker, catch denials quicker, has been, a financial increase for us to see those outcomes so quickly.
Yeah, that's great to hear. And curious as well, what is, I guess, if you had to say sort of the biggest difference before and after implementing Adonis, what would that be for your team at Redefine?
I think it's, blinders, a horse with blinders and a horse without them, right? I feel like we see clearer now. And not that we weren't before. We have an analytics team. We were running reporting, but you have to dive through that reporting. You have to really interpret what's going on. Being able to log on to Adonis and see graphs and, log right in, and it says to you, there's been a decrease in revenue this week from Horizon. And, we're jumping right in. Why? Why is there a decrease? What is going on? It's been, a big game changer for us.
That's awesome. And Dan, curious as well from, your in-depth experience at Athena, where does Adonis add the most value for Athenahealth users?
I think if we kind of use this slide as our guide, because each row maps to something that every Athena practice is already feeling, right? So there's the reactive anomaly detection to real-time monitoring and alerts, right? Athena is going to tell you that the claim hit a hold bucket, and they're going to do that well. Adonis is going to tell you payer X, let's say New Jersey, Horizon, New Jersey, the example that Kathy just mentioned, changed behavior on CPT Y in real time before it floods your work queue and you're inundated with AR. The second piece, the manual kit code translation to CARC and RARC codes are provided. So instead of your team having to do a mental map of, what the denial reason actually is, Adonis is normalizing them, right? And we're empirically mapping the Athena kit codes today, which is actually something that I'm working on delivering with our product team. The next piece, high-level dashboards to root cause analysis. So Athena is going to give you the dashboard, but Adonis is going to give you the why and the what to do about it, right, behind it. The fourth one, standardized work lists to smart work lists. So Athena work queues are customizable to an extent, but they're still broad and they're route-based. Adonis work lists are hyper-targeted. They're by dollar value, by payer behavior, and by likelihood of recovery. And then last but not least, the manual follow-up to autonomous AI agents. So this is the action layer, the voice, the API, the document submission. And the result lands back in Athena. So your team never leaves Athena to act on what an agent actually did. It's right there. So that's where I believe Adonis is adding the most value for Athena practice. It's not replacing any layer of Athena. It just makes that layer, it makes each layer smarter, right, and more actionable.
Love it. And Dan, just a quick follow-up on that as well. Where are you seeing the biggest impact across Athena customers today?
Yeah. Three areas. First, the aged AR recovery. So these are the automated claim status inquiries. So agents working the CSI calls on claims. The team would never have had time to touch, recovering dollars that would have otherwise been written off. Second is the denial prevention through payer trend detection. That's the alerting that we talked about. So catching payer behavior changes before they become, $1 million problem. Now that may be hyperbole, but if no one addresses the problem, it can become $1 million problem or multi-million-dollar problem. Third, biller efficiency, and Kathy mentioned this earlier around scaling her team. Teams reporting hours per day per biller back, which is real ROI in a very tight labor market. And I think those are the three biggest impact areas that I've seen in my time here.
Love it. Thanks so much, Dan. Great. To wrap up, we'll close with a few key takeaways and final thoughts. First, denials are strategic. Visibility is the biggest gap, and growth is constrained by payer pressure and staffing. Kathy, what's one piece of advice you'd give other Athenahealth RCM leaders this year?
Oh, gosh.
Loaded question.
I know it's a tough one.
Yeah, it is. For me, I think the biggest change is, and the biggest impact for us has been the underpayments. Catching those underpayments have been really huge for us. So, watching payers, making sure they're paying you correctly, reviewing for underpayments. That's been a big one, definitely.
Awesome. And Dan, what should teams prioritize next if they want to improve performance quickly?
Sure. One, get that portfolio view that I talked about earlier. Standing up reporting that lets the executive team see denials in AR by payer and by service line in one place. You can't fix what you can't see at the right altitude. Two, automate one workflow end to end. Pick the highest volume, lowest judgment work, usually like a no pay, no response or an aged AR follow-up, and let agents own it. Build the muscle, prove the model, then expand. And then third, get your CFO and your rev cycle leaders into the conversation. The 55% number from the survey wasn't a coincidence. Denials are a CFO conversation now. The earlier you align RCM strategy with finance strategy, the faster the resources flow into the work that matters.
Love it. Perfect. Well, I think that's all we have time for today. Thank you both very much for the conversation, and thank you everyone for joining. If you sent in questions that we didn't get to, we'll follow up shortly. And if you'd like to learn more or continue the conversation, we'd love to connect, so don't hesitate to reach out. Talk soon. Thanks, Kathy and Dan.
Thanks, everyone.
Thank you.